Welcome to Medically Speaking, a special 11-day Power Play edition. My guest today is Heidi Cober, the nurse manager of the Hematology Oncology Unit at Oishei Children's Hospital. Heidi, thanks for joining us today.
Thank you for allowing me to be here.
So let's start with the unit itself. It's named the Ralph C. Wilson Jr. Hematology Oncology Patient Suite at the hospital. Tell us a little bit about what that involves, what it entails, and what makes this unit so unique.
So this unit is a wonderful unit. We have 11 beds, and it was really designed around providing the safest and best care for our pediatric hematology and oncology patients. We have special filtration that is built into the unit that provide air safety to help protect our patients with immune system disorders, as well as special water with extra filtering as well that can help them. And we have a great team up here that really loves their patients and works well together and really is here to make sure that these families get the best care they can possibly have.
Let's talk more about the patients that you guys treat and take care of. What type of disorders do they have? What types of ailments do they come through the unit with? When people hear hematology, oncology, they may not be that familiar with those types of terms. Maybe those in healthcare are. But if you can explain a little bit more about the blood disorders and the types of cancers that you guys are dealing with.
Sure. So as far as blood disorders, our most common blood disorder that we would see on this floor would be sickle cell anemia. Different sorts of congenital neutropenias, which is kids who are born without a functional immune system that's really able to protect them from different types of bacteria. We also have all types of pediatric cancer patients. So the most common type of cancer in pediatrics is leukemia, which is a blood cancer. But we also see lymphomas, we see osteosarcomas, which are in the bones, as well as rhabdomyosarcomas and brain tumors as well. We were able to partner with Roswell Park to really be able to provide bone marrow transplant to pediatric patients of all ages. So we've done children as young as infants all the way up through teenagers. And we're able to give them the pediatric specialized care that Oishei knows so well, along with their expertise in bone marrow care to really provide the best of both worlds for our patients. It's been wonderful.
You mentioned Roswell Park and the partnership that Oishei Children's Hospital has with them, in particular with the blood disorder program. This year, the 11-day Power Play fundraiser will benefit your program in particular with some of the funds that are raised. Why is that so important for someone, from your perspective, from a leader of that part of the organization?
So we have some unique training needs that the staff on our floor has to be able to acquire and maintain to really be able to provide this type of specialized care. Each of our nurses, in addition to training in pediatric oncology and hematology, also has to do an additional 100 hours of specialized training for bone marrow transplant. And they also have to maintain 10 educational hours every year in some sort of transplant-related material to be able to maintain these competencies.
Why is that specialized treatment so important for your staff and for the patients that you serve?
Well, transplant's a very unique event that patients go through, and there's a lot of subtle changes that patients will have throughout their transplant. And it's important that we have staff who are able to pick up on those very subtle changes and be able to work with the physician team to make sure that we are able to provide timely care.
Obviously, someone that's dealing with this type of diagnosis, it's a very difficult time in their lives. They come to you for care and treatment, but there's support systems in place that can help a family and or patient get through something like this. Can you tell us a little bit more about what those systems or programs are?
Yeah, so we have a psychologist who works on our team who interacts with all of our families and really helps both the parents and their siblings who are going through this type of treatment. The team psychologist will also partner with the child's school to make sure that the school process goes smoothly. whether it be the child entering back into the school system after treatment or continuing in school while they're getting treatment. They really work with the school to make sure that process is smooth and meets the needs of the child, as well as the other children that our children will interact with. We also have a social worker who is really dedicated to making sure that families are able to find the financial assistance that they need. There's a lot of great programs in this area that are there to support our families, and our social worker is a really key link for a lot of our families. And we have our child life specialist who is really integrated in our team, and she works with the children who are admitted and helps them cope with being in the hospital. She helps them through procedures that might be a little bit frightening to a child, but she'll also help them understand what's going on in terms that they understand.
We talked a little bit before about your team, the program, but for those from outside the four walls of the organization that may not be too familiar with it, I'm going to ask you about what kind of message you have for the community as we go into the fundraising season for the 11-day power play, which is 40 crazy individuals playing hockey continuously for 11 straight days, trying to beat a world record. Why is it important for your program to be part of this? What message you have for the community in terms of your unit and the care that you guys provide?
Well, first of all, I want to thank the community of Buffalo for all of its support. We live in a wonderful area and have a great city. The team here at Oishei, we are really dedicated to the work that we do and the patients that we care for. And so we're really grateful for this opportunity to partner with the 11th Day Power Play.
Heidi Cober is the nurse manager of Hematology and Oncology at Oishei Children's Hospital. Thanks for joining us today on Medically Speaking.